Your doctor looks at your blood test results and circles creatinine. It's elevated. They ask if you take any supplements. You mention creatine. And then comes the concern. Could this be your kidneys? The answer is almost certainly no. And understanding why requires separating two things that look similar on a blood test, but mean completely different things. Creatinine is the end product of creatine metabolism. It's produced non-enzymatically from creatine and phosphocreatine at a constant rate, roughly 1 to 2% of your total creatine pool per day. Creatinine is not toxic, does not accumulate in the body, and is filtered by the kidneys and excreted in urine as normal metabolic waste. In clinical medicine, creatinine is used as a marker of kidney filtration function because the kidneys clear it at a predictable rate. If kidney function declines, creatinine filtration slows, blood creatinine rises, and that rise signals a problem. This is where the confusion starts. When you supplement creatine, you increase the total amount of creatine in your body, which increases the total creatinine being produced from the breakdown of that larger creatine pool. More creatine being broken down means more creatinine in your blood and urine. This shows up on a blood test as elevated serum creatinine. But here's the critical distinction. In a creatine supplementing individual, elevated creatinine does not mean impaired kidney function. It means there is more creatinine to filter. And the kidneys are filtering it perfectly well. The elevation reflects increased substrate, not decreased clearance. To correctly assess kidney function in a creatine user, clinicians should use cystatin C, a protein whose blood levels are independent of creatine intake, or a calculated eGFR that accounts for the individual's creatine use. Looking at raw serum creatinine in isolation in a supplementing athlete and concluding kidney stress is a methodological error. Now let's address the kidney damage claim directly. The concern that creatine damages kidneys has been investigated in multiple long-term studies in healthy individuals. The evidence consistently shows no association between creatine supplementation and kidney damage in people who begin supplementation with healthy kidney function. Studies spanning 1 to 5 years of continuous creatine use have found no decline in kidney filtration rates, no increase in kidney damage biomarkers, and no adverse structural changes in kidney tissue. The International Society of Sports Nutrition reviewed this entire evidence base and concluded that creatine supplementation does not impair renal function in healthy individuals. There are populations for whom caution is warranted. Individuals with pre-existing kidney disease, a single kidney, or known renal insufficiency should consult a nephrologist before supplementing, not because the evidence shows harm, but because the increased creatinine load in these populations hasn't been specifically studied, and medical oversight is the appropriate caution. For healthy adults with no kidney history, the evidence does not support withholding creatine over kidney concerns. The elevated creatinine on your blood work is not a warning. It's chemistry, the expected and harmless consequence of metabolizing more creatine. If your doctor is unfamiliar with this distinction, it's worth a brief factual conversation about the difference between elevated creatinine from reduced clearance and elevated creatinine from increased production. The clinical threshold for concern is different in each case, and yours is the second case. There's additional context specific in how different kidney markers behave in creatine users. Serum creatinine, the marker most commonly flagged, is sensitive to creatine intake as described, but other kidney function markers, blood urea nitrogen, cystatin C, urine albumin to creatinine ratio, and imaging measures of kidney structure, do not change adversely with creatine supplementation in healthy individuals. This is important because it allows a more complete picture of kidney health than serum creatinine alone provides. If a physician evaluates kidney function using a thorough rather than just serum creatinine, there is no signal of kidney stress in creatine supplementing healthy individuals, even those who have supplemented for years. The creatinine concern has been the subject of repeated clinical investigation precisely because it's so commonly raised as a concern for athletes. Every investigation that has looked beyond serum creatinine to thorough function assessment in healthy individuals has come back negative for harm. The quality of the evidence here is high. This is not a case of absence of evidence being taken as evidence of absence. It's a case of systematic investigation consistently finding the same result.